I've struggled with this my whole life. Just made me so insecure and life-changing. Thank you, Dr. Lebowitz.
Good morning, Dr. Lipo, Gyno, and beyond. So today I've got a 29-year-old who had surgery about 2 years ago from a doctor in Texas, from Austin, Texas, with overcorrection of the gland. I believe they did VASER and gland removal, but you'll see from the pictures, and we're going to do a video on him, that it's overcorrected, over-resected right side greater than left with a pretty severe, what's called a concavity deformity, especially when he flexes, the nipples kind of invert in, and the beautiful athletic shape to his chest has been destroyed. That said, really when you do gynecomastia surgery, and I understand people want, the least expensive, the least lengthy, the quickest recovery, the least expensive procedure, but this is your body. And to correct this, it's a lot of work. On this gentleman, we're doing VASER, high definition power assisted liposculpture of his chest, including the mid and upper belly. We, of course, are doing Renuvion J plasma to tighten everything up. Renuvion, in my opinion, works great, and it's the only FDA-approved skin tightening device that is used post-liposuction. The glands are gone. They're over-resected, as I mentioned, so we don't have to remove any glands, but we are going to scope the chest, scope the lats, scope the serratus muscles, the six-pack abdomen, the deltoids, because I like to give them that V shape. We're going to snatch the waist, give them the six-pack abdomen, and we are going to do perfect and precise fat grafting, pectoral lipofilling, probably deltoid lipofilling, maybe latissimus dorsi lipofilling, and that's a game changer. Fat grafting to these muscles after gynecomastia surgery. Now, I'm not talking, a teenager with puberty glands that just need the glands removed, but anybody really who needs liposuction, unless they're like 280 pounds, who don't want that fat put back in there, which I totally understand. But anybody of moderate weight, moderate athletic build, you have to do fat grafting. That is a game changer, and I thank Alfredo Hoyos, who's a prominent plastic surgeon, the inventor of high-definition liposculpture in Bogota, Colombia, for him teaching me on multiple occasions. I've been there, and to Barcelona, to all over the world, to train with the best. And lipofilling is a game changer. So anybody who does gynecomastia surgery on someone who weighs 200 pounds, 190, 220, you have to include the belly, because it's all about everything. You have to do Renuvion and you have to fat graft. Otherwise, you have a big chance of results that are not exceptional and having a concavity. So nowadays, good enough, and I'm saying good enough is no longer good. In 2025, good enough is no good. We need exceptional results. Just jaw-dropping, amazing results, and that is what I deliver. So you can go to somebody who's cheaper, somebody who's closer to you, somebody with, the surgery is an hour and a half rather than mine, which is 6 hours. Very well and good, and pay a lot less money, as I said, but it's one shot, and you have to do it right. And with VASER, high definition lipo, micro air, power assisted liposculpture, Renuvion J plasma, and fat grafting, that is the best. And it's the best or nothing really in my book. Anyway, all this said, Lipo, Gyno, and beyond, call me 631-424-0101 or email me at jonathanleibowitz@gmail.com. Enjoy the video, like, subscribe, and comment, and call me. I'm always available. Let's go. Now, what we're doing is, so he had previous surgery in Texas, in Austin, from a gynecomastia surgeon, and they overcorrected the gland. They did, I'm sure they did VASER lipo and gland removal, but not to the extent that I'm doing, of course. Really, nobody with gynecomastia surgery. That's why I call Lipo, Gyno, and Beyond. So the VASER is now melting the fat. The residual fat is, they don't go to the lats and to the belly and stuff. So I'm melting the fat. And I'm also, right here is where the concavity is, I'm breaking up the scar tissue. So to release it, because right now the skin is attached to the muscle. So I'm releasing that so that when I lipofill it with fat that I harvest, I'm going to recreate that beautiful inferior pectoralis definition. So I'm just freeing up now. Now I'm doing in the armpit, again getting all the fat from the armpit here. And remember, the VASER, other plastic surgeons who do not know give me shit. Oh, there's nerves and there's vessels here. Let me tell you, they are wrong. Ignorance. The VASER is ultrasound, and that saves and goes around the vessels, goes around the nerves. So there's no damage to anything. And I want that great shape to his lats back here and to his pecs up in front. So this is high definition. This is not an hour-and-a-half procedure. We're going to be here. We started at 7. We're going to be here till about 1 with all the work that we're doing. The only thing we don't have to do is remove the glands. That was taken care of. Too much taken care of. And look at what I'm doing. I'm vasering, and I'm going to liposuction this way, which is with the grain of the muscle, not against it. If you liposuction through here, I do a little bit through here, but it's superficial. But if you go deep, you go against the grain, and you'll ruin the anatomy of the pectoralis major muscle. We don't want that. Another 15 seconds here, then we go with the other side. You all right? Perfecto. There we go. Because it's such a discrepancy between what was taken and what was left that I need to whittle it down to be even and then refill it up again. So I'm just making it even, kind of blending the pec muscle, creating this midline right here. There we go, beautiful. Bye guys. So again, it's a guy, he's how old, 29? From Houston, Texas, who went to Austin, had gynecomastia surgery, was in great shape, and they really did a concavity on him, over-resected, did lipo. So I finished, I got out, oh my God, how much? 1, 2, 3, 4, really almost the maximum of fat out, just almost 5 liters of fat out of him. I purified it, here it is right here, and I'm gonna put it back and recreate the beautiful hockey stick shape to his pectoralis major muscle. I'm gonna have enough to do the pecs, the delts, maybe the lats, but let's go. So through my stealth incision, I get right underneath that muscle, there we are, and I feed it right there. So I know where I am. You can see it right there. That is purely under the muscle. And I'm gonna really just beautifully, and you can see it happen. You can almost perfectly see it. I go right into the lats here. That's where I am.
It's possible that you know it can hold more.
Yep. Alrighty guys, Dr. Lipo Gyno and beyond on this 29-year-old young man outside of Houston, Texas, where he lives. He went to Austin, Texas. He wanted to come to me, but he went there because it was closer and less expensive. But he did not have a great result. He had a concavity on the right, both sides. Terrible on the right and terrible on the left as well. So what we did, it was 2 years ago, and he came to me to fix it. So what we did was VASER, high definition power assisted liposculpture. We did the chest and the belly, mid and upper belly. You can kind of see where I went to. Stealth incisions in the armpit, by the nipple, and inside the belly button. We did the VASER. We got out pretty much almost a maximum fat allowable, which is 5 liters. We did Renuvion, of course. We did Renuvion J plasma for tighten everything up. With the lipo, we etch and define his pecs, his delts, his lats, his serratus muscle, his abdomen, 6-pack abdomen, 2, 4, and 6, the midline linea alba, and the semilunaris down to the lower, the mid to lower. Mid-abdomen as well. We etched, defined, revealed all these muscles involved. Then we took the fat, game changer, and really nobody does. A guy in Texas doesn't do it. We purified that fat and we put it back in him, over a liter of fat back in him. We put 390 cc's of purified fat into his right pec. We put 330 cc's of purified fat into his left pec. We put 180 cc's in his delts each side. and we put 60 cc's into his lats, all through the bilateral anterior axillary incision, which is only a couple millimeters in size. We did put a drain in because I want all that fluid to drain out, because I want results that are as spectacular. We're going to have post-op, we're going to have lymphatic massage. I'm going to need him to get hyperbaric oxygen because I want all that fat to survive. By the way, the fat we put into the muscle, because that's where it lives, into the muscle of the pecs, the delts, and to the lats. And look at this beautiful negative space between the pecs and the lats there. And look at the delts here. That looks incredible. So when you do gynecomastia, of course, you know, you want the cheapest, you want the closest, you want the easiest way out, but that doesn't always serve you right. If they don't do VASER, if they don't do gland removal, if they don't do Renuvion, and especially if they don't do fat grafting, lipofilling, to recreate the dynamic masculine power muscles of the chest, then you might have trouble like this gentleman did. But he found me, I took care of him, he looks great. And that's it. So Lipo, Gyno, and Beyond, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go.